Now, ladies and gentlemen, we come right to session A, our roundtable discussion. We have a panel, a distinguished panel, who's going to be kicking off this event, and we really hope that you will lend us your ears. We have over 200 of you from across the region. We're absolutely delighted that you are here with us this morning. Now, to kick off, our moderator is Ms. Lilian Mercado, Oxfam's International Co-Director for Strategy and Feminist Futures, and concurrently, she's the Regional Director for Asia. In the Philippines, she's the convener and founding member of Every Woman and Bayani, and is a member of the board of the Philippine Center for Investigative Journalism, where she once worked on the environment desk. She's a founding board member of the Citizens for the Promotion of Human Rights. Joining her, the panel are Ms. Ryce Chanchai, who's the ASEAN Governance, Peace and Security Lead at UN Women Indonesia. Over the past decade, she has worked to support the Association of Southeast Asian Nations, ASEAN, and its member states to promote human rights and gender equality. Most specifically, she is currently leading the regional program Empowering Women for Sustainable Peace, Preventing Violence, and Promoting Social Cohesion in ASEAN. Joining her is Ms. Margaret Araujo. Ms. Araujo is the Program Officer at ILO Timor-Leste. Since 2019, she has been focusing her work on the Spotlight initiative launched in Timor-Leste as a multi-year partnership between the European Union and the United Nations to eliminate all forms of violence against women and girls by 2030. In Timor-Leste, the initiative is focused on the elimination of domestic violence and intimate partner violence. And our third panelist is Ms. Aura Sevilla. Ms. Sevilla is a program consultant for Southeast Asia and older workers at Women at Informal Employment, Globalizing and Organizing, also known as WIEGO. Ms. Sevilla primarily works in improving aging and social protection policies, gathering evidence, advocating for change with the government, providing technical advice, networking, and building the capacity of older people and workers in the informal economy. Ladies and gentlemen, I hand you to our panel. Let's have a fruitful discussion. Take it away, ladies.
Good morning. I hope you can all hear me. I'm Lilian Mercado and I'm calling from the Philippines. Thank you for that excellent introduction. Before we start the panel, I just want to thank the Ambassador de Cartier for opening our session today. And thank you very much for emphasizing the role of social protection, the importance of focusing on women, and for crediting Oxfam. None of our work would have been possible without our partners, including governments and civil society, as well as the business sector. So I do want to also credit the people and the organizations that we work with. I also want to greet a very good morning the members of our panel today, and thank you for gracing this occasion and lending us your expertise. Thank you, Ryce, Margaret, and Aura. I'm sure we will have an excellent conversation. And finally, I just want to greet the members, the participants of the audience. I now see that we have 225 in this call. What a good number that we have, and indicates to me the high level of interest in this topic. So maybe we should kick off. We have a few questions for the members of the panel. And as you have heard, the participants will also have the opportunity to send their own questions. But let's kick off with a few. And let me begin perhaps with Ryce. Ryce, and maybe this is also for the rest of the panelists, we are all aware how the COVID-19 pandemic has severely impacted the socio-economic development efforts in the ASEAN. I mean, the pandemic has always been reported as a health issue, but it is a health crisis with multiple dimensions, one of which is the socio-economic aspect. The crisis has also disproportionately affected women and girls with far-reaching consequences across every sphere, from health to economy, even to physical safety, to social protection, and has underlined the need for meaningful lasting, and I should add, feminist solutions. The pandemic has brought to light the importance of social protection in stabilizing shocks and socioeconomic crisis, and how the absence of social protection can exacerbate the pre-existing inequality and push people into deeper levels of poverty. So, Rice, let's start off with you. Enabling social protection in Southeast Asia has been a sustained effort by the ASEAN. We all know that, from webinar to webinar, and even in previous face-to-face meetings, we know how much the different actors in Southeast Asia, including the ASEAN, has put importance on social protection. But yet, much remains to be done, and this is indicated in the 2020 SCAP and ILO report, which states that less than half of the population in Asia Pacific is protected by at least one social protection scheme, with women being particularly disadvantaged. What do you think are the reasons for this, and how does this affect the women of the ASEAN?
Thank you, Lilian, and very great honor to be part of the esteemed panel member and to join you to discuss these very important issues, very, very close to my heart. Social protection, because I personally believe in the need for everyone to have an equal level playing field, right? To have a chance, to have a fair shot and a fair chance. And social protection is actually giving that opportunity. If you look back into the past 2 decades, right, I think social protection and the debates on the need of it has come and go, and it has pronounced a lot during the time of crisis. And if you look at the development, by and large, a primary focus of social protection has been on poverty reduction, on addressing inequality. That is largely focusing on income inequality as opposed to looking into the impact of multiple deprivation from the gender lens. In practice, what does this mean? It means that when you look into the database to measure and target social assistance support that focus on who would be receiving, who are the beneficiaries, they tend to focus on household as a unit of analysis, which what does it mean when we said that the data is focusing on the household as a unit of analysis? It means that it assumes equitable resource distribution or wealth and power within the family unit, right? And many times when we're talking about the gender dynamic, when we're talking about having women as a beneficiary, it means that we need to really look into intra-household dynamic. That is the power dynamic, that is how resources are distributed and how decision-making power within the household is being made. And this is not, in a way, equip us in the design and the implementation of social protection today to look into that. And as we move forward or towards multidimensional poverty, addressing risk and vulnerability, quite from the UN Women perspective, and a lot of us feminists who work on this, we would say that we cannot limit to income risk and economic risk, but we also need to look at socioeconomic vulnerabilities. And when we look at socioeconomic vulnerability, social protection has been doing really well on the areas of basic social services, like health and education or WASH. While this is really, really helpful, it also doesn't really have the gender dimension within it, and it's actually stemmed from the data. In every crisis, though, like particularly this one, there are always an opportunities to course correct, particularly because the crisis at the moment actually revealed how gendered structure our economies and our system has been. And therefore, it actually highlighted the issues of critical importance of care work, which has been invisible and undervalued. When we're talking about women economic security, a lot of our efforts are focused on what? Focus on maybe at best, maybe have the measures that focus on women without actually knowing. The best that I've seen probably like focusing on women-headed households, but that's conflating the issues of living arrangement with other issues, because you can have a woman who's actually the breadwinner of the household, but are not registered as a head of the household and therefore not qualified for the benefits. So there are exponential amount of error in terms of targeting the women who are actually needed, or women in informal employment for that matter. So I think that the issues of safety and care has been exponentially important, right, in the current crisis, and is so connected to the issues of addressing economic and social vulnerability. And traditionally, social protection is not looking at violence against women. It doesn't look at the issues of how do we support women on the care and child care and early education so that they can go to work. I cannot come to work without my husband helping hands or someone else to support me, right? And all of us are in the same way that have children. So I stop here to say that in the past, these dimensions are not traditionally included into social protection intervention, but the COVID crisis has revealed the need to connect the dot, that we need to also address violence against women. If we wanted to address economic security, we need to address the connection with care work and childcare and elderly and whoever that actually affected by the crisis, whether it be it pandemic or be it disaster or any other emergency situation. So therefore, these are something that we all need to discuss, starting with the data, the database, and how we look at the issues. Over to you, Lilian.
Thanks, Ryce. I think that's an excellent starter. I'm very happy you brought out intersectionality, that we cannot just look at income inequality. Inequality also is very much related with other dimensions. And I'm also very happy that you highlighted care. Maybe we can come back to that later, because there's of course, with the generation equality, gaining momentum, there's also a lot of focus on care. You said that one of the reasons is really how we're analyzing the need for social protection, and you did mention that our analysis being founded on household as the unit of analysis misses the gender aspect. And so maybe, Aura, can I come to you? And if you can go into an explanation of why gender matters for social protection design, and how can social protection interventions address the different aspects of poverty and vulnerability aside from income, which Ryce has started us on, and that all of these dimensions of poverty and inequality are perhaps experienced more intensely by women during their life cycle.
Yeah, thank you so much, Lani, and also thank you for inviting WIEGO to be part of this very important event and well-attended event. So I also agree with Ryce with everything she has said, and maybe I would just highlight some of the things or add some of the things she already mentioned and her points. So first and foremost, before I go through why social protection can address the different needs of women, I just would like to talk about why gender matters. So here I have 3 points. First, I'd like to walk you through with the different constraints and also risks that are very specific to women that they are experiencing across the life course. So in general, we have 3 major life cycles. We have the childhood, we have adolescence and youth, and we also have working age, and finally old age. So what are the risks or constraints that girls experience at childhood? Usually they still have the gender bias. In our textbooks, we still see girls as the one who's helping the household, so doing the household chores. While in general, in the region, the primary and the secondary school girls have not disadvantage, but in secondary school, girls have seen more dropouts. For instance, in Cambodia, 1 in 3 Cambodian girls have the opportunity to finish secondary high school. And if they finish, if they go through adolescence or at youth phase, this is where also early marriage, pregnancy are very predominant still in the region. And also what we have education segregation, wherein if you get into the college, usually women will take courses that are still ascribed to their role, so, like hotel and management. So still that ascribe to the roles of women. And at working age, this is the time where women faces, of course, caregiving and domestic work. When we talk about caregiving, it's not about only children, but they also torn between two competing priorities, like taking care of their children and also taking care of their aging parents. This is a very common trend in the region right now, where we have this what we call sandwich generation, and most of the care work are all drawn to women. So in effect, they stop working, they stop contributing to their social security system, and they are often concentrated in lower quality or irregular and informal employment. And at older age, the caregiving doesn't stop. So they continue to take care of the family, but this time not on their children, but to their grandchildren and to their sick spouse or sick members of the family. So they are often also have lower savings and assets. They have lower pensions. They are more likely to be widowed than men. They are more likely to live with disability. And in fact, women also have lower retirement age. In Vietnam, for an instance, women retire at 55 versus 60 years old for men. So apart from this life course, there are two trends in the region that we need to focus on. One, there are still women that comprises the majority of the informal work, in particular in countries such as Myanmar, Laos, Cambodia, Philippines, and Indonesia. And these are countries, and this means if women are concentrated in domestic work, they often are informally employed or do not have or have vulnerable contracts to begin with. And if you don't have contracts, you don't have employer relationship, then you do not have access to employer-related social protection. So, and this means that women do not have access to maternity benefits, unemployment insurance, sickness benefits, or old age pension. In the region, we only have Thailand, Philippines, and also Singapore that provides maternity benefits for the self-employed. And the last trend is that in ASEAN, we see that aging in ASEAN has a female face. ASEAN region is rapidly aging, with women comprising 60% of the older population in ASEAN. So, but unfortunately, older women receive less income than older men. They also have fewer savings, few assets. They're likely to receive pension. And if they do, they have very low levels of pension. So many women in the region continue to work despite of ill health and also disability because they don't have pension. And most of this, if they have pension, this is also gender bias because most of our pension system is based as well on their earlier earnings. So this disadvantage in pension, in financial security in general, are brought about by the cumulative disadvantages women experience throughout the life course in education, in employment. These are the reflection in older age. So how do social protection address the women needs? First, I'd like just to highlight that addressing women needs is just an add-on. It's not an extra, it's not an option, but should be the central to any social protection. So for instance, if the children receive child benefits, they can improve girls' health, education, nutrition, and also protection. If you give younger women access to adequate reproductive health services, they have a critical bearing to their future life chances. Or if you give them scholarship or education assistance that are not ascribed to their roles like science, mathematics, the jobs that are actually high paying. So you also give them a better career trajectories. And if you give at working age social protection such as maternity benefits, provision of childcare, this can enable women to stay at work or protect them when they cannot work. So, and finally, when you give adequate social pension, adequate old age pension. This can enable women also choice if they would like to continue to work or to retire. So in general, or ultimately, social protection needs to challenge cultural norms that we have that limits women opportunities and life chances. And ultimately, social protection can give women choices if they would like to be, to what career they'd like to pursue, or what they'd like to be, a homemaker or a businesswoman, or if they like to continue to work or just to retire. So, yes.
Thanks, Aura. I think that is a lot of that you said. Hopefully, triggers other questions because I think you've touched on a number of other issues related not just to social protection, but related to women's equality in general. And I know that you've already, I was listening to you intently, and I'm quite happy that you touched not just on the structural, reasons that disempower and put women at a disadvantage, but yet that you've also touched on social norms and cultural norms that hold women back and hold, unless they are addressed properly, even through, or through, also through social protection schemes, that then we will not get the full optimization of such an intervention. And maybe this is a good time to ask Margaret. So when social protection programs, Margaret, are designed in a transformative way, and we've already heard from Aura and also from Ryce, what are the areas that need transforming? Whether that's the unit of analysis or how we put women central at the core of social protection, and that they should also be addressing not just income, but also the intersections of inequality for women. So can you reflect on how social protection can promote itself, can promote self-economic and social empowerment in a transformative way? And how can they promote positive changes in gender norms and roles, as well as in relations between women and men? I think you're on mute, Margaret.
Thank you for the opportunity given to me. It's a pleasure to be here in this forum, just to share what we, from ILO, we shared. So by answering the question, I would like to say that social protection policies and programs can be transformative to women. It is an important tool in reducing poverty and inequality if well designed and implemented, can help to prevent women and their families fall into or remain in poverty, promote access to healthcare and education, contribute to economic growth by raising labor productivity, and enhance the social stability. So during the shocks and crises, the social protections plays an important role as an automatic economic stabilizer. So the social protection need to be sensitive to different needs of women as they experience poverty differently. So social protection can have a transformative potential for the poor, disempowered, or otherwise vulnerable segments of the society, particularly women. So I come up again from another segment in which the social protection floor can promote and connect women to income and access to essential services. Why the social protection floor is a powerful approach? Social protection floor is a powerful approach because it's an anchor in human rights, the principle of social protection for recommendations, and principle of social justice and in the universal human rights social protections, can address human life cycle and provide support in situation of poverty and insecurity, enhance women empowerment and facilitate women participation in a decent and productive employment opportunities and promote gender equality. So from that social floor information, I'll come up again to the foundation of social floor, the foundation of social floors. which is access to healthcare and basic income security throughout women's life cycles, and other three ways, which is the income security for girls, women in active age, and income security for working women. So from those information, I would like to say how can social protection promote gender equality, women empowerment, and promote positive gender relations. So from those point of view, I will I will say that this come up to the two dimension which related to the extension of social protection coverage to social benefit for all, and then coverage gaps affecting women and access to labor market and decent employment. So social benefits can be via cash transfer, as you all know, and then also can be to the to be in kind should be in kind transfer. So from the social benefits in kind cash transfers can be offer a minimum level of protection to women via social security contributory benefits and or non-contributory benefits, including informal workers. And then increase the self-term consumption, increase the common over resources, improve self-esteem, improve bargaining power of beneficiary, incentive women to participate in community life. So a lot of benefit that the women can be. And also another part of social benefit, which is the in-kind transfer, can play an important role and enable women to participate in formal employment, for instance, through public child or elderly care, and also free education. Promote equal access to healthcare and education, giving women and gives opportunity to develop their productive potential via free healthcare or school meals coverage. Promote access to reproductive health, promote access to gender-based violence support services, and generate income to sustain livelihood. So from all the questions that you raised, I think the information that I can share with you on this in this content is the one that I just shared.
Thank you, Margaret. I think you touched on a variety of aspects, but I think there is still some danger that social protection is often seen still by many as a temporary solution, no? Or a superficial solution. And Ryce, I think I'll come back to you with a question on, how do we ensure that social protection is not a band-aid or just seen as a safety net, but that it really leads to a fundamental shift in how governments as well as the private sector, employers, corporates treat work and workers, and especially women. And when I say work, you do know that I'm referring also to care work and how much care work contributes to the total economy.
Thank you, Lilian. That is very important questions, and let me be concrete. I want to highlight three key important features that will actually really for us to address the social protection as a main focus and not a plaster bandage. And this is, you know that this is going to be quite a bit of an uphill task, because we have some time of wrong placement of the priorities. A lot more people are more excited about talking about economic growth rather than equally sharing that growth into equitable development. So the first key feature that I would like to highlight is, first of all, very key to have gender data and analysis that inform policy decision making. Secondly, we need to encourage a greater cross-sectoral collaboration in crisis and recovery. And I think COVID-19 recovery plan of ASEAN provide a very good pretext for us to really address this issue. The third and the last is that gender sensitive measures and action need to be backed by strong indicators and resource allocation. Let me go into the specifics. On the first point, when we're talking about gender data and analysis, I'm talking about my previous point, basically to come up with not only gender analysis, but also multidimensional approach to address challenges that are interrelated. We as UN Women are very proud to have a chance to take this journey with ASEAN and advancing gender data and statistics to inform evidence-based policy decision making. Many of us feminist activists, sometimes were not taken into account very seriously by policymakers unless we come up with concrete data. As you know, right? The numbers doesn't count for everything, but sometimes what doesn't get seen or counted are not counted by the government or into policy. So much of these efforts and our efforts to work with ASEAN to co-own and generate gender data analysis of the COVID-19 impact can inform the implementation of the ASEAN Comprehensive Recovery Framework, as well as national recovery plans, which has a strong feature on social protection, but maybe not necessarily operationalized on how we actually focus on women. The gender data can also help to target and prioritize beneficiaries in response. And here, let me highlight these important issues of ASEAN because COVID recovery is further complicated with the overlapping natural hazards and conflict-affected areas, given that ASEAN member states geopolitically and geographically located in one of the most disaster-prone regions in the world. You will see that many vulnerable regions are also both conflict affected and affected by disaster, and therefore, having a policy response that include the gender perspective and the environmental perspective can really help reassure disaster preparedness, risk mitigation, and prevention of future crisis. And this already taken account by ASEAN's the ADMARE, which is also linked to ASEAN Comprehensive Recovery Framework. So that's one. Second, when I talk about cross-sectoral collaboration is key, I actually mean concretely working with the ASEAN sectoral bodies. For instance, at the moment, UN Women support the establishment of the technical working group on protection, gender, and inclusion that is comprising of all the representatives from 10 member states, and it brings the sectoral bodies that are working on disaster and crisis together with the ASEAN Committee on Women, and then serve as a cross-sectoral platform to ensure commitment towards gender equality is translated into regional policy framework that enhance protection and empowerment of women and girls in the region, also in line with ASEAN UN Plan of Action in the next 5 years. And this gender mainstreaming is placed, and let me emphasize, as a cross-cutting priorities for all three ASEAN community pillars to renew and addressing this across the board. Thirdly, and finally, we have also seen some important progress in the ASEAN region for adopting gender-sensitive measures. And based on UN Women and UNDP COVID-19 Global Gender Response Tracker, and I invite you to go and Google it and try to play with it if you are interested, the audience in here, is that 8 of the 10 ASEAN member states have already adopted policy measure for COVID response and recovery that address violence against women, even if they're maybe not seen yet as social protection, but I think we have been quite vocal in actually integrating addressing violence as part of the comprehensive social protection packages. Nevertheless, the measure to target women economic security have been adopted only in 4 ASEAN member states, while measure to directly support unpaid care work have been adopted only in 3. So there is definitely room to do more. To ensure that the commitment in policy and plans are translated into action, we need, as I mentioned, gender relevant indicators to track progress towards gender sensitive post-pandemic recovery. And simultaneously, dedicated investment to close resource gaps are needed to achieve gender equality. I don't want to mention particular countries because I think that we're all here to support each other. But I see, for example, right, when we're looking at the government measures on cash intervention or social assistance support, at best, it would say focus on women beneficiaries. At worst, is talking about let's say, for example, we need to stimulate the economy. We want to support micro, small enterprises. without the pretext, we kind of know, right, that a lot of women are actually in the sectors of informal employment. We also see that a majority of them are actually women own micro small enterprise that are the backbone of the economy. But yet there is no specific measure that allow for women-owned micro small enterprises to actually access those funds and actually get benefit, to get back on their feet and actually come back to participate in the economic opportunities and empowerment, which is critical, right, in ASEAN, where you have 80% or 90% of the economy rests on micro enterprise, not even small, okay? Indonesia, for instance, very clear. You can look at the statistics. So I think that the more important targeting measure that goes beyond just say, we're going to target women, is actually to actually design a system that makes it possible to address those gender barriers or any potential discrimination that can come consciously or unconsciously. Last but not least, let me highlight that we believe very much in more diverse representation of women and men in the COVID response and in this task force, to ensure that the specific needs of marginalized groups, especially women and girls, can be included in development planning and budgeting of COVID-19 recovery and response and recovery. You would hear that I talk about COVID a lot because I seize on these opportunities that, when crisis hit us, it shows the gaps of the areas that we have neglected that could have actually save us, right, to actually deal with the crisis. So I hope we learn from this opportunity and take it to the heart in actually not forgetting that we have half of the population that's supporting a lot of vulnerable population in this region, be it elderly, be it children, that we said are the most precious things for us. Over to you, Lilian. Thank you.
Thanks, Ryce. I know you mentioned ADMER. I'll just take a moment to say that I was actually an advisor to the ASEAN when we were trying to get ADMER together and ratified in all 10 member states, which we were able to do. And I was quite shocked by the numbers that you cited in terms of how many member states have taken up the issue of economic security. And so I think there is really a lot of work at both country level and regional level to push for policy reforms, but also how to translate these policies into practice. And I know that you mentioned COVID. I mean, the focus of our discussion today is very much on the pandemic, but let's not forget that before the pandemic, we were already experiencing the impacts of the climate crisis. And of course, we all hope that the pandemic could continue to be facing the impacts of a climate crisis, which seems to be worsening. So within this perspective, in light of this, more on what ways social protection can be made more gender transformative in its, perhaps not just in its design, but also how do we really improve the way it's analyzed? Yes, of course, the design. And as you heard also from Ryce, how do we become more persuasive, more compelling in its and support a much better, much more effective implementation, and more importantly, I guess, address women's specific needs, including those working in different employment arrangements. Someone mentioned informal work earlier. I think that might even be you, Aura.
Yeah, this is really, most of what I'm going to say is already mentioned by Ryce. So maybe I would just emphasize some of those. And I would like also to point out 4, I think, important measures that we can do on how we can make it more gender transformative. So first, maybe Ryce already highlights the very importance of data. But I just like to emphasize that we need gender disaggregated data collection and analysis, because most of data systems in the region are still not set up to accurately inform our policymakers about the gendered coverage and impact of social protection intervention. Data should not just be collected and disaggregated based what we are actually promoting is at least SAD, sex, age, disability, disaggregated data. But we can also include employment arrangement, ethnic minorities, and also migrant status, which also would highlight the intersectionality of different issues of different groups of women. So this also should emphasize the need for gender sensitivity vulnerability assessments, and that this information, gendered information, will not be only useful for collecting data for early warning system or early warning purposes, but can also inform, like what Ryce said, decision making. So some already initiatives in the region that we can build upon is the ASEAN Gender Outlook, which also developed with UN Women. And now we are in ASEAN, we are also launching the ASEAN Gender Mainstreaming Strategic Framework. So these are all positive steps, but we just really need to systematize things, especially in the data collection and analysis, starting off with training as well, the National Statistics Office, also informing the importance also of community level data. So the second thing I'd like to emphasize is adopting a gender lens and also life course approach in the design phase of the social protection. So here, we have to emphasize about or give special attention in addressing the gendered burden of care. So there are already innovations on this in social protection design that could shift the gender norms related to caregiving, such as, for instance, providing care credits, incentivizing shared family responsibilities, linking cash transfers to care services, and gender transformative intervention. One sample is not in the region, but in Latin America, in Mexico, wherein they have the Estancia Infantiles para Apohor. This is a program providing childcare subsidies for low-income working mothers. So maybe this is something that we can pilot test in the region if it's also effective. Another that we can already do in adopting gender lens and life course approach is we need to remove provisions in our social protection services that reinforces gender bias. Ryce already mentions we have this social assistance or cash transfers that actually have conditionalities that reinforces or emphasizes on the women's need to meet certain conditions associated with some that actually adds to their time burden. So some impact studies on some cash transfer in the country, I won't mention the name of the country, also look into women as just conduits of this money and not really gender specific to their needs. And lastly on this is on engendering old age pension. We need, in some countries, the women pay higher premiums for their pensions because they live longer, and we need to index the pension because women live longer. So, and we need to emphasize the need of universal social pension because when many women work in the informal economy and they get older, they do not have pension. So Thailand made a very good best practice on this or good practice on this, where they introduce not only universal healthcare, but they also introduce universal a social pension where all women can also have a minimum pension based on their age. And third point is, yes, Ryce also mentioned about resource allocation, but I'd like to emphasize with gender sensitive budget allocation. In the South, in Asia Pacific, 2.1% of our GDP are actually spent for men versus only 1.9% for women. And even the social insurance expenditure is actually favoring men. So this has to change. ASEAN member states should level up their investment to care economy and also gender responsive social protection, because failure to do so would risk the perpetuating generations of poor women and already driving those already vulnerable groups further to the margins. And women's contribution, both paid and unpaid, is not just how we could just recognize their contributions, but this is also one way to pay them back. So having a gender-sensitive allocation should not be seen as a cost, but actually an investment, and also the rights of every woman who are also contributing to the society. So finally, my last point is also mentioned by Ryce, working in partnership with broad coalitions of women, in particular informal worker women and women of all ages. So we need voices of women. In particular, we have social insurances that we need the voices of women in the informal economy in the tripartite or social dialogue, because usually the social insurance only engage labor groups, unions from formal sector, but they do not include informal sector. So we need women here. And we also need to champion women's leadership in the board, not only in the technical working group, but also in social security board. So we need to increase the quota. For an instance, in the Philippines, at the minimum, you have 2 women in the board for your social security commission. So we need to put something, a positive a quota like that. And in the regional level, it was already mentioned that there's a technical working group, and ASEAN's Declaration on Social Protection is already a positive step. But unfortunately, this lacks nuance on the very specific of roles of women organizations in the design and as well in the implementation of social protection. So we need to have a very clear engagement mechanisms, like what Ryce mentioned, the technical working group. So there are member states here, but what are the roles of women's organization here? And what we can also say is that we should go beyond, the ASEAN should go beyond the GO, Government NGO Forum, the ASEAN People's Forum. We should go beyond this. We really have to establish a clear mechanisms for where women of all ages, particularly informal workers such as home-based workers, domestic workers, street vendors, can have meaningfully engage effectively and meaningfully. So we at WIEGO are working with several groups of informal organizations in the region, the HomeNet Southeast Asia, the International Domestic Workers Federation, StreetNet International. They are all here in these sessions. And they are also trained to do gender social audits. So they can actually be tapped as one of the partners, development partners of ASEAN. And they're not just conduits of decision making, but they should be part of the decision making because this is for them. So in general, there are 4. That in summary, there are 4. We need data system. We need social protection schemes that not only address needs of women, but also do not perpetuate existing gender bias. Third, we need gender-sensitive allocations. And fourth, very importantly, we need women as part of the decision-making. And that we can only say that truly we have a gender-transformative social protection in the region and could help in achieving the ASEAN community goal for 2025, at the same time, the SDGs of leaving no one behind. So thank you. So back to you, Lilian.
Thank you. Yes, thank you, Aura. Oh, by the way, people have been calling me Lilian, but I actually go by the name of Lan. Sometimes I don't even recognize that name, but that's fine. For formality's sake, we can go with Lilian. But Aura, I really like your point about the voices of women, because these conversations cannot be limited to just the so-called experts, no? The organizations. The more that we get, especially the voices of grassroots women into these conversations, I think the more transformative the approach to social protection can get, because inequality, as you know, as we have been saying over the past hour, I think, it's not just about income. It's really also about, and it's not just about opportunities as well, it's also about voice and power. And so if we do want to address the disempowerment that women feel, the inequality that women are experiencing, we have to also address the political dimension of economic empowerment. No economic empowerment for women will happen without political empowerment. So their voice, their participation in decision making is equally important. Um, I'll come back to one other aspect because I think so many times the issue of care work has been mentioned and how much the burden of care work has added to time poverty and has held women back. So if in an effort to provide better social protection to women, as you have said, no, some countries have set up child benefits, but of course that's well intentioned, but has also contributed to the entrenchment of certain norms, of certain biases, expectations, traditional roles on women. So it does put, not just implicitly, but explicitly puts the responsibility on women because the expectation is that women will be responsible for caring for children. So it doesn't touch on the redistribution of care work. And also many countries provide maternity leave only to mothers, but don't take into consideration paternity leave. So the whole dimension of parental leave is a big dimension of this discussion. Are any one of you, Margaret, Aura, or Ryce, are you aware of any country that has implemented successful interventions that shifted the mindset that mothers or women, not just mothers, there are aunts, there are grandmothers, that women are the only people responsible for care work, particularly for children? Do you know of any country in
would
Asia or
I would
maybe other regions?
I guess I would not say that there's like we achieve or arrive at any countries that really like achieve at that sort of transformative mind shift in the mindset, but I think there are some emerging good practices that has been observed, chiefly in South Asia and in Latin America. I think there are a group of academia who's actually look into the link, for instance, between social protection and address to intimate partner violence or changing of behavior or like built-in behavioral change kind of possibility into social assistance support. For instance, in interventions such as enhancing nutrition for children, they do engage the father as well into the work in Bangladesh. I can actually share with you an academic research on this. I think it was pretty rigorous in those type of programs where it has been very intentional. So like I said, not just at the surface targeting women beneficiaries, but really the design in actually intentional social behavioral change, have a control group vis-a-vis the uncontrolled group, have a follow-up evaluation where you actually compare the actual during the intervention and post-intervention to see how does the change take place. Unfortunately, we don't have a lot of that in Southeast Asia just yet. We did try that in Indonesia in COVID response, but I think it's very preliminary because our funds is very small. So I would say prototyping that type of work where we actually look at challenging the assumption for cash for work. If you all work on social protection, you know cash for work is really focused on infrastructure developments, very focused on manual labor, very not super gender sensitive, no matter how much they try. You know, you can actually add in childcare facility or whatever, but by design, it was not really for women. It's for manual labor and construction of reconstruction of infrastructure after in post-crisis situation, right? So we're trying to challenge that a little bit, and we work with CARE Indonesia and test and work with women cooperative and women self-help group to really look into their skill set. There are a lot of women who actually been laid off from garment factories. So we get a group of these women together to produce a PPE kit and get the marketeers to help with the marketing. And then we also engage the male partner into the gender training, so they can see how that can be transformative, because we can never assume, right, that just because you can add income for the women in the household, it's actually going to be all nice and rosy for the relationship and the power dynamic with the household. It can go either way. So I think engaging male partners and the partners of our beneficiaries are important, especially in places where you have entrenched social cultural tradition that may not allow women to go out and work in a public space at certain times. We also have some of these experience in Pakistan, where it was quite revelation for me to hear from my colleagues, right, that they engaging the male partners and the villagers that are predominantly male, and they said that the first time the male comes and they're like, okay, you know, like the second time they also come because they have to accompany the women. The third time they're like, okay, well, you guys go. We don't really need to be there anymore because we know that it's not really threatened our positioning in any way, and it sort of have that level of comfort in terms of engaging them in from the start. I think that's kind of shift a little bit of the equation, but I would not say that we have arrived at any kind of transformative. You can say, oh, this country achieved this and that, but I think we have pockets of evidence that we can build on if there's an intention to work on this.
Just checking if, thanks, Ryce. Just checking if Aura or Margaret have encountered any examples.
Okay. There are very, like what Ryce also said, there are some in the regions. I saw also UN recently published, UN Women also published a gender responsive social protection in Southeast Asia. So it includes as well some good practices. I just shared the link in the chat box, but some of those that are mentioned, like there are already very specific approaches in conditional cash transfer in the region where it is categorized whether it's gender sensitive, it lacks gender sensitivity, or it barely or didn't have, or gender blind. So one of the samples there is the Pantawid Pamilya program, or the conditional cash transfer in the Philippines, wherein their convergence, their explicitly includes gender considerations in its design, and that they're piloting this convergence strategy in conjunction with other government programs to help beneficiaries graduate. Although, to be honest, I have also a very distinct position in the graduation approach in social protection. But in general, in the design phase of this program, it says it's gender sensitive. And they mentioned some case studies and samples from Bangladesh. It's poverty reduction targeting the poor program. It also mentions about, well, I mentioned already the Mexico childcare subsidies for low-income working mothers. It also highlights the program in Ethiopia, the design of productive safety net and program. So it's not something that we're going to build from the scratch. There are already things that are developed somewhere in parts of the world that already mainstreaming gender in their social protection. What we are lacking is actually some impact analysis on these programs. Maybe that's something that we could start. If we could do, for example, the universal social pension in Thailand, if we could do a gender analysis, how this impacts older women in the informal economy, and whether this has reduced fertility, or whether this has reduced this increased decision-making of women in the households. Does this include independence and dignity among women? But so we need more evidences as well, and also gender data to come up with the conclusion whether this social protection already has impact in the country in terms of gender.
Thanks, Aura.
Sorry, Lan. Can
Yes,
I just quickly, just to course correct, otherwise I'll be misrepresented a little bit by the audience. Not to say that we don't have any gender sensitive programs in our region. We do have it. What I meant actually was a more transformative type of social protection program that link issues of safety, link with issues of unpaid care, beyond the type of targeting economic security like cash program. We do have some of that, and actually UN Women did have some of those programs, also that publication that you mentioned. But I think we wanted to push a little bit more boundaries, I think, because they were so separated, the issues, right, of violence and economic security, of unpaid care versus paid side of the economy. And I think that's where I wanted to see more pushing the boundaries in terms of influence behavioral change, power relation, decision-making dynamic within the household, and that's much harder. Over to you, sorry, just to be clear. Otherwise, a member state might actually banish me for saying, how can you say we don't have a gender-sensitive program? We do.
Yes, I do acknowledge that, and I'm glad that you jumped in to make that clarification. But I do also see the necessity of pushing the boundaries, because as we said earlier, we don't want this to be just a band-aid. No, we want to go beyond the superficial level. And you mentioned cash for work, Ryce, and maybe this is a good opportunity to mention a pilot that Oxfam did in the Philippines during a disaster response. And of course, cash for work is one of our standard responses. But we designed it in such a way that care work was also acknowledged as work, and therefore, was included in the way that the entire cash for work was designed and distributed. So stay-at-home mothers, grandmothers, aunts whose job was to take care of the family also received cash disbursements. And like Aura said, I think we need to do some kind of an impact analysis. What really changed from that? Not just in terms of appreciation for cash for work, but in terms of shifting mindsets. But one of the things that was also mentioned is that when you infuse money into a household, it doesn't necessarily always mean that relationships, power relationships change. In fact, this can sometimes be a factor for increased threat, increased violence towards women. And so, Margaret, if I can turn to you, because COVID-19 has been accompanied by this silent pandemic called violence against women. So domestic violence has actually increased and highlighted the vulnerabilities that women experience, not just outside of the home, but in the home. What do you think, and is there a role for social protection in addressing efforts in eliminating domestic violence or intimate partner violence?
So, thank you again, Lilian, for the question. So actually, by eliminating the domestic violence, intimate partner violence can be addressed, from the point of ILO, can be addressed by two main agendas. First is through social protection floor, which can be through the income security and access to essential services. And then secondly, can be through the decent work agenda, which will be more related to aspiration of the people in their working lives. So linked to your question, I would like to link a little more to the world of work, which for ILO point of view, the world of work might provide an entry point to mitigate the effects of domestic violence and intimate partner violence. So as the convention says, the Convention 190, which is just recently ratified, is eliminating violence and harassment in the world of work, notes that governments, employers and workers, organizations, and labor market institutions can help to recognize, respond, and to address the impact of domestic violence in the world of work. So employers and other actors can be allied to address such a violence, take measures toward mitigating the effect of domestic violence in the workplace, address social norms and behavior that underpin domestic violence and the impact that has on the women workers and her workplace, acknowledge the right of women to work independently and have independent income, which can also provide a pathway to live from a violent relationship. Support access to specialized services enable victims to stay at the job and live independently. So apart from the convention, the recommendation to 206 set out a number of measures that could be adopted, which include innovative response into three types of measures, which is to providing leave and temporary protection against dismissal, promoting healthy, inclusive, and supportive workplace, and facilitating access to services and to justice. So for these three types of measures, I would like to emphasize that the each by each, like providing leaves and temporary protection against dismissals, leaves help persons who are experiencing domestic violence to attend court hearings, seek counseling and medical help, and move their children and themselves into a safe environment. So it means that can provide providing leave ensures that victims who do not find themselves in the situation of having to choose between leaving their abuser and quitting their jobs. It can also be important for victims empowerment, but they can secure their financial independence as they attempt to address the consequence of their abusers and leave their consequence of their abuse and leave their abusers. So the labor laws protect victims against being dismissed for a certain period of time. This is in relation to the providing leave. And then also another part is the promoting healthy, inclusive, supportive workplace. It is a key to build the healthy, inclusive, and supportive workplace in which the victims feel comfortable to seek help and disclose their situation without fearing more victimization and shaming or job loss. So the recommendation asks for the provision of flexible works arrangement for victims of domestic violence. This is a part of promoting the health. And then also another part is facilitating access to services and to justice. Like addressing domestic violence is time sensitive. It needs to be stopped immediately. Yeah. It is important to encourage victims to seek help as soon as possible. Like awareness raising campaigns, both in and outside the workplace, in which victims can seek help, are the key. Likewise, providing information at the workplace or existing public measures and services that mitigate the effects of domestic violence and support victims can be another way of employer to support the victims. So by answering your question, and I think I have provided the point of view of in the world of both world part of view. So I'm back to you, Lilian. Thank you.
Thank you, Margaret. That was really comprehensive. And thank you for giving us a holistic view on the link between social protection as well as violence against women, and how we can use social protection as a means to address this problem that women have faced for the longest time. And despite all our efforts, still doesn't seem to abate. We are nearing the end of this session. We have 2 minutes left. And maybe just by way of, I won't even dare to summarize or synthesize, because I feel it had been a very, very rich discussion. But maybe just to pull out a few key things, that for one, social protection isn't just about leveling the income dimension of poverty. It really has to link, if we want it to be effective and transformative, we should be able to link it to an intersectional analysis of inequality as experienced especially by women. And that to do this, we will need to improve the way we are collecting and analyzing data. We need to make sure that the analysis of data is infused with a gender analysis. We need to have stronger indicators to make our argument much more compelling. and that we need to also be able to see women in the entirety of their life cycle. Because as one comment in the chat box said, a big challenge is really addressing the needs of elderly women. And whether you're young, middle age, or in your elderly years, women do bear the burden of care work. And so social protection measures have to be connected with our understanding of care work and the social norms that perpetuate not just the burden of care work, but the status of women in society. Including, because women are still, the esteem, the rights of women are still, despite the many decades of championing this since Beijing, the Beijing Platform for Action, which, by the way, started me off on my feminist journey. Violence against women continues to loom as a large threat to all women. But there are challenges, big ones ahead of us, but there are also opportunities. And the pandemic and even the climate crisis gives us the opportunity to continue working on this and making breakthroughs. But none of these breakthroughs will happen without the representation, participation, and voice of women themselves, especially grassroots women. So social protection that seems, on the face of it, addresses economic empowerment has to be coupled with political empowerment. And I hope that the messages, the very excellent inputs from our panelists today resonate with the rest of our participants. And I thank Ryce, Aura, Margaret for all of your excellent inputs and sharing. I'll hand back to the host at this point. Thank you very much.
Thank you so much to our distinguished panel. We appreciate each one of you for your time, for your effort in joining us, and for sharing so openly and speaking about such important topics. That was our session A. And to our audience, we thank you for being with us, for your questions, and for just paying such earnest attention. We appreciate you. Now, a gentle reminder, this entire event is being recorded, and we will share this recording at a later time. It will be made available on Oxfam's website. So stay tuned for that. Not to worry, we don't want you to miss out on anything. So the entire forum is going to be recorded and it will be made available. Now we move on with the program, ladies and gentlemen. We are now honored to have Her Excellency, Mrs. Arunzaya Ayush, the Minister for Labor and Social Protection of Mongolia, to present Mongolia's initiative on social protection for women informal workers. She's been working as a member of the Cabinet of the Government and Minister for Labor and Social Protection of Mongolia since July 2020. Previously, she was the chairperson of the National Statistics Office of Mongolia from 2016 to 2020. Ladies and gentlemen, Her Excellency Mrs. Arunzaya Ayush of Mongolia.
Distinguished delegates, ladies and gentlemen, it is my honor to make statement on behalf of the government of Mongolia on the Mongolia's initiatives in providing maternity protection to self-employed and informal workers, in particular women entrepreneurs. Well, in Mongolia, 54% of total working age population are women, and the participation rate of women in labor force is 52.7%, and the employment rate is almost 50%, 49.2%. According to the 2019 year-end report of the National Statistical Office of Mongolia, there are around 200,000 people employed in informal sector out of 1.2 million workers, and almost 41.8% of those are women. The UN Sustainable Development Goals include poverty eradication, decent work and economic growth, and the ILO decent work goals cover job creation, employment rights, social protection, of course, social consensus. Parliament has adopted a long-term strategic action, which is called Vision 2050, which prioritizes to improve the data registration of the informal employment, support decent work for all, encourage economically active participation among the working age groups, poverty alleviation, of course, decent and productive jobs, expand middle class, which is the most important one in eradicating poverty. The decent work section in the state employment policy implementation indicators also provides a gradual increase in the share of formal employment and social insurance contributors. The share of informal employment increased by 23% in 2015 to 14.4% in 2020. So we do target to reach 11% by 2025. Also, I'd like to share about the following studies on informal employment have been conducted in Mongolia. For instance, study of on the shadow economy by the World Bank, informal sector employment survey by the National Statistical Office, formal entrepreneurship and competitiveness survey of the ILO and MONEF, also Mongolian mining impact assessment of employment policy and regulations in non-governmental sector, labor force survey, which is conducted regularly by National Statistical Office, development of communication strategy to support transition from informal employment to formal employment. So you see, we are having a lot of data surveys already there. But now it is important to use all the data and to have policies which are based on those surveys. Worldwide, all the policy decision makers out to make decisions based on real data and real evidence. This year, in order to update our strategic priorities on formal employment issue, the ministry, with the support of the Formal Employment Protection Project for Economic Diversification and Inclusive Growth, implemented by the International Labor Organization, is conducting a survey on informal employment status at our research institute. So we still have issues to be regulated by law with regards to the informal employment, but it is of course possible to have registration and more correct data on the taxpayers, also to cover by social insurance in accordance with the laws of social insurance, taxation, personal income tax. Of course, the majority of informal workers are capable of paying contributions due to their incapable of paying contributions regularly because their income is also not so much regular. Of course, less than the minimum wage to pay social insurance premiums, really difficult to regulate, especially when 30% of population of Mongolia is not having the nomadic, still traditional way of lifestyle. Their work area is also moreover traditionally and also in informal sector, agriculture as also the livestock area. So basically, women make up 50.7% of the total number of social insurance payers, as also in Mongolia, half of the population are, of course, women. So the contribution is also equal. On the other hand, for the female insured, the payment of contribution during childbirth may be interrupted, resulting in a short number of years of service and relatively small number of pensions and benefits. Currently, the birth rate per woman in Mongolia is 2.9, which means most of women in Mongolia are having up to 3 children, which means every time they are giving birth to a child, the contributions to social insurance, as also the work time is interrupted. That's why the government of Mongolia has initiated a number of policy measures in recent years to address this issue, to help women and mothers, to include their pensions and benefits in more affordable and favorable bases. Also, we have amended the legislations. Currently, the mothers insured, if they are having more than 4 children who were born or adopted before the 3 years and raised up to 6 years, can retire on the terms of the mothers of many children. They can retire with 50 years. They requires at last 20 years of pension insurance premiums. Well, maternity benefits are also a common frequent service that are now available for from the Benefit Insurance Fund, regardless of the number of children born during the maternity leave. During this period, the employer shall be responsible now for the premiums paid during the leave of the insured. It can be up to 3 years. The employer shall be responsible for the social security. The compulsory insured persons were paid 100% their average salary during their maternity leave, and the voluntarily mothers were paid 70%. And now the regulation was changed that the voluntarily insured mothers can also have 100% coverage due to the parental leave, maternity leave. Women decent work promotion is very important in sense of we are having a lot of children also born in recent years. So the kindergarten and schools have to be built, and it is very difficult to speed up to be in pace with the speed of the children's birth rate. So the government of Mongolia is also introducing a service for daycare for the children, which is also very important for women to get back into the labor. The banking system is also the economics and the banking system is also very much supporting now women entrepreneurs. So World Bank funded employment promotion project is giving also loans to women. Women decent work promotion activities should be carried out within employment promotion policies and activities, not only due to government, but also the public and private sector. So we do suggest that women's decent work promotion activities should be carried out within the employment promotion policies activities in accordance with the futures of possible to support them in creating flexible forms and conditions of employment, create a legal environment, improve the rules, regulations related to remote and electronic work, do work from home, especially during the COVID time, we have all learned to work from distance. So it is now very much important to have these new ways of possibilities in new job areas. Remote electronic skills are also with this very important. So support with electronic equipments, women who are trying to work from home is also very much important. So that's why we suggest all countries to support women in who are trying to work electronically from home. Public and private services and standards for children and of course elderly care is very important. Women responsible not only for home for children, but they are also responsible for the care of the elderly. So it is very much important to develop public and private services so that women can can participate more in labor force. These are the information and the possibilities that I wanted to share with you. My colleagues would be also honored to answer your questions.
Thank you so much to Her Excellency Mrs. Arunzaya Ayush, the Minister from Mongolia. And joining us now today to answer your questions, we have Mr. Batjargal Basan, the Director of Social Insurance Policy from the Department of the Ministry of Labor and Social Protection of Mongolia. Now, ladies and gentlemen, we do have a few questions here. And if any of you would like to pose a question or two, just go ahead and raise your hand on Zoom or key it into Slido. Good morning, Mr. Batjargal. Thank you for joining us. Now, the first question that we have here, now, could you please share some of the experiences of gender transformative measures in the labor force, such as paternal protection in Mongolia?
Okay. Okay. Good morning. Good morning. Can you hear me?
Yes, we can, sir.
Okay. Thank you. Good morning, all colleagues and all participants. Very nice to meet you in that event, and I will give you some social protection information about Mongolia. And Mongolia has a very huge and good social protection system right now. And for example, we have a great health insurance system first. And end of 2020, and 95% of total population covered in the social health insurance system. And second one is social insurance system. And in 2020, and approximately and 80% of economically active people covered in social insurance system. And third one is we have also social welfare system, and people who cannot get any pension benefit, any child care money, and they can get the pension from the social welfare system. And the next one is we also have very good education system. People who live anywhere, the city, provinces, and so on, that they can get the education services anywhere, anytime. And then next one is we have the child money. It's a kind of cash transfer service. And the child money program was implemented since 2012, and during the COVID-19 pandemic situation, the child money increased from 2,002 MNT, Mongolian Tugri, to 100,000 MNT, and it's about $45 each month and each child. And I can concentrate that social insurance program, and Mongolians' new social insurance system has been in place since 1995, and it's legally possible for a rural target group herders, actually it's the women, self-employed, to be covered on a voluntary basis. In accordance with the respected legal regulations, social insurance offices are committed in nine districts in Ulaanbaatar, capital city, 21 IMACs IMACs means provinces, and 230 farms in Mongolia to fulfill those achievements. In other words, social insurance services and especially 230 local administrations and 21 provinces and provide social security services as a one-stop shop, one-stop service center, which allows herders, farmers, women, and self-employed to receive services quickly and at the low costs. Taking into account the income instability of the rural population and women, the voluntary social insurance contract specifically states that the contribution can be paid on a monthly, quarterly, semi-annual, or annual basis. For example, as a herder woman earn income by selling cashmere and animal products in the spring, milk in summer, and the meat in autumn and the winter. This flexible payment schedule is closely linked to their income cycle. And starting from 2020, we had the COVID-19 pandemic situation, and total of 23.5 billion Mongolian tugrik were paid as social insurance premiums in almost 200,000 voluntary insured people. This insurance is supposed vital action in order to prevent from the reduction of pensions and benefits for herders, also the women. And starting from 2020, 50% of contribution paid by mothers caring for their children in total of almost 20,000 people will be paid from the benefit insurance fund or state budgets, which is an important step in ensuring social security for herders and self-employed mothers. In light with the common use of mobile phone and internet by Mongolian citizens in both of urban and rural areas, herders and self-employed have been able to enter into and renew voluntary insurance contracts using mobile phones and pay their contribution by social insurance and banking application, internet banking, mobile banking, and Coupe, which greatly allow to receive services regardless of time and spaces. Information of premiums paid by the herders and self-employed people insured with social insurance can be obtained online through a number of electronic channels, such as the official website of the organization, which named the Social Insurance General Office, and application and e-government service machine, e-Mongolia portal, and application as well. One of the 10 most commonly used e-service during the quarantine periods in 2020 included social security contributions. In 2021, the ministry have just introduced an electronic social insurance and pension books and provide all the retirees with the bank accounts and cards. This saves a lot of time and money for the insured and the pensioner and allows all social security service as transparent.
Thank you very much, Mr. Bajagal. Thank you, sir. We have an important question here that we want to draw your attention to. Based on your experience, what would your recommendations be to other ASEAN countries to design more gender-sensitive schemes?
Yeah, thank you, and thank you for your question. And first proposal is in government and parliament must pass all the needed regulations, some laws, because we need to implement any kind of program, but it's based on must be based on the laws. For example, we have many laws, such as social insurance law, the pension law, and the benefit law, and the gender equality law, maternity protection law, and that is all. Second one is we need the infrastructure system, because even though we have the law, we do not have infrastructure such as employer and the state officers and some digital contents, and also you need some programs. Also, you need the computer. Also, need some software. And this is two most important proposals to you. Thank you.
Thank you so much, Mr. Bajagal Basan. Ladies and gentlemen, in lieu of time, we can't continue with any more questions. Thank you for joining us, sir. We appreciate your questions, your answers, I should say, and thank you from the entire team from Mongolia.